Norma, are you here? Good. I'm just making sure you were still here. So our last speaker is Norma Rodgers. We all know that there was a massive increase in the amount of acupuncture given for treating people with fertility problems since about 2002. It's been seen in different surveys, and much of that is as adjunctive treatment with IVF. Most of those practitioners aren't working in the NHS, but Norma is one who is. She heads up an acupuncture service for a hospital centre, fertility centre in Liverpool, and she's going to tell you about the study that she's putting forward to do with comparing the birth outcomes for women who've had acupuncture and those who haven't at the fertility centre. Norma.
Thank you, Mark. Thank you, Mark. Right. Well, thank you very much for inviting me here today. I want to talk to you. Can you hear me at the back? Yeah. I'd like to talk to you about my research study, which is into the effects of adjuvant acupuncture on IVF outcomes. Problem is, we've been talking about today, it takes a long time to get approval to do these research studies. So I'm still in the process of getting ethical approval. So I'm going to talk to you about the design of the study. Unfortunately, I can't talk about the results today. I'm the lead acupuncturist at the Hewitt Fertility Centre at Liverpool Women's Hospital. So there's a picture of Liverpool Women's Hospital, and you may be familiar with that from episodes of Hospital and One Born Every Minute. That's where that's filmed at. It's a lovely hospital. It's a women's only hospital and treats gynecological conditions, maternity, and also fertility. It's got the Hewitt Fertility Centre there. It provides fertility services for the whole of the northwest of England and beyond for NHS and self-funded patients. And it's one of the largest fertility clinics in Europe, treating an average of 3,800 transfers per annum. So that's quite substantial. It's a very forward-looking clinic. And very research-based. It's always looking at how it can improve outcomes. So it was one of the first clinics to use the embryoscope as standard practice for not only private patients, but NHS patients as well, because the evidence was there. And as soon as the evidence is there, they will put the treatment in place. And also it uses things like embryo glue as a standard, and that's supposed to help IVF success rates as well. So the success rates are consistently amongst the highest in the UK and probably Europe. The one that I've quoted here is for clinical pregnancy rate, which is where heartbeat's seen in ultrasound. And so the rates, and that's for IVF and ICSI, and blastocyst transfer at per cycle. So the rates are that should be under 35, not over 35. Under 35 is 38%, which is pretty considerable. And 35 to 37 is 29%. 38 to 39, 25%, which is, I think, a very good result. And over 40, it's 17%, which I think normally you're looking at 5%, 10%. It's a lot lower than that. So the acupuncture service, I set it up in 2011, and they decided the clinic asked me to come in and set it up in response to patient requests for acupuncture being on site. I've got the support. The clinicians are very, very supportive. The nursing staff, the embryologists. So it really is we're integrated in the unit. The only thing is we're not NHS funded. That's one step too far to actually get any money to run it. We provide a 6-day-a-week service, and it's provided by 3 acupuncturists. We're all TCM trained and BIAXI members. I've made it a condition of the acupuncturists that they need to be BIAXI members, because BIAXI has got we've got guidelines. We've got guidelines for practice, and we need to work in the NHS. The first thing is we have got to be safe. So we need to have very strong guidelines. We need, I'm looking at doing things like standard operating procedures for being there. We need to start taking on all the things that are standard in the NHS. We need to adopt that as well. So we wear uniforms, and we try to be very professional. All of us have done further training for fertility acupuncturists, and we've got quite extensive experience. So we've got 40 years experience between the 3 of us. Patients self-refer and pay for treatment, and we see an average of 16 patients a week and 750 appointments a year. So it's not a lot of patients a week for 3 acupuncturists, but we've got very fast throughput because people are coming in for a cycle. They're not coming in for a long treatment normally. You don't get them coming in for, some people will come in for like over 10 sessions, but a lot of people are just coming in for a very fast treatment. Acupuncture, they can book individual sessions or 1 to 2 standardised treatments on or around the day of transfer, or 5 treatments at specific times during the IVF frozen embryo cycle. Those 5 treatments, we do the specific times. We do the first one just before the period. If the patients, currently at the Hewitt Centre, the standard protocol is being on 10 days northisterone for 10 days, which is an oral contraceptive pill. So I normally book them in at day 10, day 11, so that we can get a good movement of blood, clear out the lining, so we get a nice fresh lining, building up a nice fresh lining over the cycle. Then we do 2 sessions during stimulation, and we try to do 2 on the day of transfer. If we can't do that, we're not open on a Sunday. If we can't do it, if it's on a Sunday, we'll see them on Saturday and Monday. Other patients will come in, we'll book 10 or more sessions, and we run that before and during the cycle, or we may just do it all before their cycle. They've got freedom of choice how they want to program those sessions. So, right, okay, so the service has been running for 7 years, and after that I've got quite a lot of data, and I was very interested to know what's our outcomes. Are we making any difference? And compare them to the Hewitt Centre standard IVF outcomes. I've built up a comprehensive appointments records database because the finance department take the payments. So I've had to put in your bill in for the patient's appointments, all the details. So it's absolutely ideal. So I have got 7 years of records on a database. So we decided originally it was going to be a service evaluation, but something happened in communications with the NHS research admin person who told me she was going through the menopause, and the end result was I was told it was research. So that was a totally different ball game. But I just thought at that point, I'm just going to run with it and go along and do a research study. So since it was research, I could then use a control group. So I'm going to use the database that I have and then the Hewitt Centre's database to do a retrospective observational cohort study. And so a cohort study is people of the same, in the same year. So we're going to look at patients over this 7 years who have had acupuncture, who haven't had acupuncture, and compare them, match them, so that we can compare the two groups. Doing a cohort design and being able to match the two groups allows us to build internal validity, because something like a retrospective study, it's not, it's difficult. Someone was saying earlier on, looking at the different studies, from a research, from a randomized controlled trial, case study to randomized controlled trial. Something like a retrospective observational study is is lower down in that build, whatever. But we're doing it this way does help us to improve the internal validity. It's not possible for us, because I'm using data that was collected on a clinical basis. It's not possible for us to screen out the confounding factors. It's not possible. The data is going to be a bit messy because it was collected for some other reason, for another reason. So the data may not all be complete. It may be incomplete, but that's just one of the problems of using the database. But studies have suggested that using, if it's a well-designed study, you can get similar results to an RCT. You can get very good results from it. So the study is going to be the research design is a retrospective matched cohort study. Our aims are to investigate the effects of acupuncture and IVF outcomes on live birth and clinical pregnancy rate, and whether the number of acupuncture sessions or the patient age affects outcome. Duration, it's expected to take 1 year, so I'm hoping once I get research ethical approval, it should progress quite quickly, because it's just a matter of running the database. The subject number, don't know yet till I've applied the inclusion and exclusion criteria, but we expect it to be in the region of 250 acupuncture subjects and 250 controls. So it's a reasonable size study. So the study team, the chief investigator is Dr. Daphne Chong, and she's a subspecialist trainee in the Women's Hospital. And the reason she's the chief investigator is she's got a full-time contract with the hospital, and to get the hospital to sponsor us, the chief investigator had to be a full-time member of the hospital. So Daphne kindly agreed to take on that role. I'm principal investigator, and then co-investigator is Professor Roy Homburg from the Homerton Hospital, who's also he manages the research. He's a bit of a mentor for the people who are doing research at the Fertility Centre, and he's been very, very helpful, very, very good at helping me to design the study. We've only just got a statistician on board from Liverpool University, so that will be very useful to start working with him, because that's a bit weak at the moment in the statistics area. The rationale for the study, right, well, despite we've had a lot of studies, 40 clinical trials and 9 systematic reviews since 1999, but despite that, there's still no clear answer as to whether adjuvant acupuncture improves outcomes. Because the studies, there's a heterogeneity of study design, of data collected. So it's difficult for us to give patients advice when they say to you, does acupuncture really work then? And it's difficult for the clinicians as well. So it's difficult for the acupuncturists and for the clinicians to say, right, yeah, we'll recommend the acupuncture. They do recommend it, but they say there's other outcomes. So they say it builds resilience in patients, and gets patients, maybe it'll make them have more IVF after having IVF failure. So therefore, that way, they're more likely to get pregnant. The other question I think is interesting is most studies use a standardised treatment of 2 sessions on and around transfer. Now, as we all know, that doesn't reflect how we actually practice acupuncture. it's a very small dose of acupuncture. Does it just have a transient effect? Does it just give a little bit of a spark at the time of transfer? You get implantation, clinical pregnancy, and it doesn't progress any further because you've only briefly lifted whatever the problem is, and but not enough to make an ongoing difference. So I'm interested because we've got a chance with these patients to look at having longer sessions, having longer treatments rather than just a dose of 2. So we'll look at that, and as I say, it says a number of observation studies have reported increased live birth rates where the subject had 4 or more adjuvant acupuncture treatments. That was Leigh Hollander-Rober, who was here last year. Karen Gallen, who's been here, talked about her study, which is going to be published quite shortly, and COAM 2012. Some studies have also reported improved outcome in older age groups, and the study is interested to look at that. We've got the possibility of looking at the different age ranges and seeing if we've got any particular, it benefits any particular age range. So the research question is, does acupuncture treatment before and during IVF cycles have an effect on IVF outcomes compared to usual care only? And does the number of acupuncture treatments or age have an effect on outcome? So my hypothesis is that having a regular acupuncture before and during the IVF cycle will lead to higher clinical pregnancy rates and live birth rates compared to subjects having either usual care alone and increased numbers of sessions will correlate with a higher live birth rate. Also, I think though the subjects who have got poor IVF outcomes will show the greatest improvement. The reason for that is that as we go along, oh, sorry, right, okay, I've just been told I've got to speed up. Right, as we go along, as it gets better, as they get better at doing IVF, the difference we can make becomes less, basically, because we're only going to normalise things. We're not actually going to supercharge anything. So people who've got higher pathologies, that's where we can help the most. So my study objective, I've got time to do this? Yeah. Right, okay, study objectives. So we want to assess the effect of adjuvant acupuncture on IVF ICSI outcomes over a 7-year period with a matched group of patients who had usual care alone, and then want to assess whether the frequency of the acupuncture sessions has an effect on the outcomes by analysing patient outcomes by number of sessions as a continuous variable, and also comparing outcomes of patients having 2 to 3 sessions on or around the day of transfer with those patients having 4 or more sessions before and during their IVF ICSI cycle. We'll also analyse patients' outcomes compared to the matched cohort by age to assess whether acupuncture is more beneficial for any age group. We will look for safety. We will look at compare the frequency of miscarriage in acupuncture and control groups. So I won't do the population eligibility because I've also got the inclusion criteria, so they both say the same thing. So the outcome measures are, primary outcome measure is live birth after 24 weeks gestation. Secondary outcome measures are clinical pregnancy rate, measured by fetal heart activity, multiple pregnancy rate, and miscarriage rate. The demographic data we're going to collect is age group, cause of infertility. That's going to be a bit difficult because in the unit's records, which has got the outcome and everything we're going to be using, that hasn't always been entered under each patient, so that's going to be incomplete. The date and number of acupuncture sessions, and then some embryo data, so things like the date of the first or second IVF or ICSI cycle, number of mature oocytes obtained, number of embryos transferred, the quality of the embryos transferred, and whether it's a day 3 or day 5 transfer. The unit centre, they try to always do a day 5 transfer, but it doesn't always happen. So inclusion criteria is all patients who have had a first or second IVF or ICSI cycle between over the 7 years. and had 2 to 3 acupuncture treatments on or around the day of transfer, or 4 or more acupuncture treatments before and during their IVF or ICSI cycle. All biomedical diagnoses will be included, and then we'll do a control cohort who will be matched by age and demographic characteristics. Where the subjects have had both the first and the second IVF ICSI, only the first cycle will be included in the research. So we're not going to look at patients who've had 5 IVF cycles or 3, because it makes it statistically difficult. Or so I've been told by Prof. Homburg. Whether the statistician agrees with that, we'll see. But at the moment, that's what we're planning to do. The exclusion data are all patients having frozen or embryo transfers or frozen oocytes, donor egg transfers, or as I said, more than 2 IVF ICSI cycles or an abandoned cycle. Or patients, so the consent, patients who have not given written consent for the information to be used in non-contact research. When they come in for IVF, they sign a human fertilization and embryology authority research consent form. So that's what we're going to be using for our consent. The problem with that is that it's in their patient notes, so I'll have to get some admin help to go through the patient notes to see if they've given their consent, because I won't be allowed to do that because I'm not a member of staff. So the current position is still awaiting the wheels of the NHS bureaucracy grind exceedingly slowly. So I'm still waiting to get approval to start the study after about 6 months. But I've now got a sponsorship. The Women's Hospital has now agreed to sponsor the study. So we've come under the wing of the research and development team. And I've got the protocol already, and the next thing is got to make an application to the HRA via the Integrated Research Application System. So that's all ready and waiting to go once I get them to sign, get the research department to sign it off. And we'll then have to go to the Research Ethics Committee for approval. We're hoping that this can go to a smaller subcommittee as a proportionate approval, because it's retrospective, because it's not interventionist, it's just looking at data. And then once we've got approval, we're able to start analysis of data and hoping to complete March next year. So I'd like to say thank you very much, a very, very big thank you to the British Acupuncture Council for giving us our grant, because that is going to fund our statistician and fund our admin staff and just fund the study generally. And hopefully I'll come back and report what's happening. So thank you very much for listening to me.
Any questions, please, for Norma?
I was just interested, I can take a guess, but why you excluded the frozen cycle?
It makes it harder to use statistical analysis, so it's easier just to look at, because there's 2 different studies, so we're just looking at the fresh only. It's something we can do later if we can, if it calls for it.
Just get your stats. Hello. Hi, thank you very much. I'm just curious to know where you got the figure of 4 treatments prior from, please. How did you decide to make it 4 treatments rather than 5 or 6?
We make it, it's actually 5. It's 5 treatments we generally do. We've got like a package, so it's very popular with patients, so they'll pay for a package of 5 sessions, and as I say, then we space those throughout the IVF cycle.
Cool. Thank you.
I think, okay, one last question here, and then we'll finish and go for the drinks. You've got the last word.
Thank you again, Carol. I'm just wondering, when you're doing all the writing up, are you going to take into account any particular changes in specific protocols that you might be using, or what kind of points you're going to be using at the time?
Yeah, I'll definitely look at things like that, because we have actually changed. We started off using the Polis protocol, and I think in about 2014 we adopted the Delphic. There was a Delphic process which came out with acupuncture points, timing of acupuncture, a bank of points you should use, and points that should be used in the pre and post scenario. And I think I prefer that. It seemed to make much more sense to me than the Polis protocol. So we decided to change over at that time. Okay. So yeah, all of these things will be written up, because as I say, it's messy. It's going to be a bit messy data, because it is what it is.
Yeah. Thank you.
Thank you. Thank you very much again, Norma. And can I say a big thank you to all of our speakers today, please. And thanks especially to all of you for coming today. And thank you to our sponsors once again, Kevin. And now we're finished, and please, if you can, join us in the drinks reception right outside. Thank you.